Jessi Bon, and I am the city manager for the City of Mercer Island. Today is Thursday, March 19th, and this is our live situation briefing. I'd like to begin by introducing Mayor Benson Wong to share a few words.
Thank you. Sadly, this pandemic and the health and economic crisis that it has created will impact the island and the world for some period of time. Last week, we aired the city's first situation briefing that informed the community on how the city is responding to this pandemic and how it is ensuring that core services will continue to be provided to the public. The City Council, City Manager, and her entire leadership team are committed to keeping the community informed about your city's operations. While every effort is made to be as current as possible, we have all witnessed how quickly things can change since our first situation briefing. At this time and going forward, the city manager and her leadership team will be scheduling and providing the public with weekly situation briefings, most likely Thursdays at 3 p.m. In addition, some of these briefings from time to time will include presentations by different community organizations who have information to share that might be of particular interest to various segments of our community. For instance, today, we will have a presentation by members of the school district and also one from the Mercer Island Chamber of Commerce. While members of the City Council might not be physically present during future briefings because these briefings are intended to focus on operations, if you have questions about what you hear during any briefing, or if you have any other question, you can always contact one or all 7 of us who are on the City Council. Each member stands ready to serve and help. We are all in this crisis together, and we will get out of this crisis together as well. Thank you. Jessi.
Thank you very much, Mayor Wong. And at this point, I need to reiterate something the mayor just said. Although the City Council is not here today, they are working tirelessly behind the scenes. It's been kind of an interesting role reversal. I'm actually delegating tasks to them because we need help. So thank you to the mayor and to the rest of our council members for everything you're doing to support the staff and the community. It is noticed and very much appreciated. The agenda for our briefing today, again, we just heard from Mayor Benson Wong. We will be hearing from the Mercer Island School District, the Chamber of Commerce, and then we have several staff members here from the City of Mercer Island. So at this time, I'd like to turn the presentation over to Superintendent Donna Colosky. Donna?
Good afternoon. I am pleased to be here with Assistant Superintendent Fred Rundle, and together we will present an update on the Mercer Island School District's response to the COVID-19 pandemic. We have a series of slides that were presented to our board of directors yesterday evening at a special meeting that was our first virtual meeting. We will continue to post when our meetings are going to occur. We are holding them virtually, but we'll have access for the public to those meetings. So thank you to our board directors for being available and being responsive to our community's questions. Before we go through the slides, thanks to our island community for your patience, your offers of help, and sharing your thoughts with the school board and myself, as this is certainly unprecedented, having a school closure for 6 weeks. We do appreciate your support. We know how disruptive the closures are for our MISD families. Our team has been working nonstop over the past week to ensure that we provide nutrition beginning this week to all children on the island as needed, and childcare for healthcare workers and first responders beginning next week. The Superintendent of Public Instruction has encouraged us to think of this as a spring break, a pause in instruction as we look toward how to move forward. We continue to work on how we will engage our students in learning outside of traditional classrooms, both in the near and far terms. Our staff truly misses being in the classroom with our students, but I want to emphasize that, at least in the short term, this new reality will not require students to engage with their teachers for the length of a typical school day. Learning in front of a screen that virtually replicates the classroom is not what is in the best interest of students and does not reflect what we believe will meaningfully engage learners and keep them excited to learn. Our teams are working with districts near and far to develop solutions that will navigate us through the short-term closure as well as longer closures if they come to be. The district continues to follow state guidance that districts should not offer a learning model unless it can be accessed equitably by all students. We are working collaboratively with the Mercer Island Education Association on the details of the work performed by our certificated and classified staff during the closure. The closure of schools with the expectation that staff continue working remotely is a change in working conditions and must be agreed upon by the district and staff. But I am happy to report that as of this afternoon, our Mercer Island Education Association and district representatives agreed on the parameters of what this new reality looks like. I am grateful for our partnership between MIA and MISD. And so now to our slides. Just a reminder for all in the community of our board policy 1, that students are the priority. We have been given 5 priorities from the Office of Superintendent of Public Instruction. This is the statewide office that guides all of the work that we must follow their regulations as a public education system. The priorities were outlined by the governor in his closure of schools statewide, as well as by the Office of Superintendent of Public Instruction. The first priority that the governor mandated was nutrition, that we provide meals to all of our students who need them. The next priority the governor mandated was childcare, specifically for healthcare workers and first responders. There is a great concern that we cannot impact our healthcare system during this crisis. Thirdly is graduation. We know that we have a class of seniors that are extremely anxious as to how this final year in our system is going to unfold, and we will be working directly with each of those students towards what their graduation will look like. Our employees were mandated through OSPI as to how we would work in this new reality, as well as how we will pay our employees. And then finally, teaching and learning. How will we continue to engage in this? So nutrition, we are very pleased and proud that we were able to get this up and running very quickly. On the first Monday that we were closed, just at the beginning of this week, we served more than 150 lunches. These are grab and go lunches that parents can pick up that follows the current healthcare guidelines. It is available for all 0 through 18, not just district students. And we've been serving over 100 each day. These are available at the north end at our high school and at the south end at our middle school. Childcare was the second mandate from the governor. This is that we are to serve our kindergarten through 5th grade students, and it's not just our students, as a last means of resort for healthcare providers and first responders. The regulations for childcare have changed dramatically, not just for us as we try to implement this, but for anyone who is providing childcare, particularly because, of course, of this virus. Very specific requirements on numbers of students, how the students can be mixed or not, what is the ratio for each room, how well checks will be taken care of, what are the stringent requirements for cleaning. So all of these requirements are being worked on by staff, and we anticipate being able to provide this childcare sometime next week. Fred is going to talk about graduation.
Thanks, Superintendent Colosky. Just adding on, we know that this is a disappointing time, might be a frustrating time, and certainly an uncertain time for our graduates. And first and foremost, we want to impress upon our families and our seniors that you will graduate this year. We think it's going to look different. We've been asked whether or not the graduation ceremony will go on as planned, and obviously that changes each and every day. We do have a work group in motion with principals, teachers, counselors, district administrators, thinking through all of the implications of ensuring that our graduates, especially those who may not be on track at the current moment, can still get back on track and graduate with the rest of their classmates in June. We have to consider the credits earned, graduation requirements, testing requirements, including the Smarter Balance assessment, and passing the classes that are currently on hold. We, of course, have secondary concerns as we think about our juniors and other high schoolers in terms of their SAT, ACT, dual credit, and AP testing, all of which come into play. So again, just to reiterate, while it is an uncertain time, we will make the most of it and ensure that our graduates have a meaningful experience in their final semester of high school.
And just a note for all those who are watching, this slide deck is available on our website, as well as a more explicit explanation that was given to our board at their meeting yesterday, where you could hear the conversation as well. So I encourage you to watch that. We are going to go quickly through some of these items. The next one is about staff. Our students are our priority, but our staff really matters. We cannot do our work without our fabulous employees. And so some of the things that we've had to consider is compensation for our staff. We've been assured through OSPI that our staff during this closure will receive their regular pay. We've been working through remote access because that's been the directive, is to have as many work remotely as possible. It is a challenge in the work we do. And we are also having some essential staff, just like everyone does, who does need to do some reporting, and so making sure that they are safe as well. We've been discussing what does the work look like. It's very different for our employees moving forward during this time. And to just quickly address staff morale, our staff are disappointed not to be with students. They are eager to participate in the next steps in particularly supplemental learning and meeting the needs of all of our students. We are thrilled to have our agreement with our staff moving forward, and hope to visually and virtually be able to touch base with all of our students after this pause this week. Fred is now going to talk a little bit about teaching and learning.
Our first priority was getting resources in the hands of all of our families as quickly as possible. We knew to flip to a virtual environment in the time that was allocated was not going to produce meaningful results. We saw some of our other school districts take a pioneering spirit with that and commend them, but we also know that they had to withdraw many of their early initiatives. So our focus has been, and our mantra has been, steady and fast, apply gentle pressure relentlessly, and we'll produce a product for our students in a learning environment that will be meaningful for the rest of the duration of this closure. So online, families may find MISD published resources. We will be updating those regularly. And as Superintendent Colosky had mentioned, our goal in alignment with our Fundamental 7, as well as our board expectations, is it's equity and access for all. How do we make sure that our students, regardless of the needs they may have, the accommodations they require, the language they speak, can access in a meaningful way all of the rich opportunities our staff can provide? Our grades and credits and progress reports will go on. We will release a statement tomorrow, or a letter to our kindergarten through 8th grade families. That second trimester progress reports will be coming forth in the next week or so. And we're focused on our staff, thinking about how we can continue to develop professionally in this new era of learning. In terms of technology, we had over 70 families respond to our survey requesting technology. To date, nearly all has been delivered or handed out, with another open house scheduled going on right now. We'll continue to offer technology support. We encourage our families to reach out to our tech team if they're running into trouble with our apps or online access to any resources we're publishing. Please reach out. We're ready to help. Our next focus is to think about our seniors, as we had mentioned, but we're calling it Operation Stay Engaged, or Engage MI. How can we continue to engage our students? And right now it's in a very light way, and we will be thinking about new and creative ways to ramp that up as we navigate these uncharted waters. We appreciate the community's support, their understanding, and knowing that we might not have school in the way that we envisioned it today, but that doesn't mean tomorrow won't have creative solutions.
And just to conclude, we want to remind all of our families about the importance that we have really placed on the whole child and the social emotional learning for our children. This is anxious times for everyone. I encourage you to check out our resource page. We have several resources there on how to talk to your child about this current crisis and how to make sure that we're all staying as healthy and as safe as we can, both physically and emotionally and mentally. Thank you.
Thank you very much to the Mercer Island School District for joining us again today. And Donna and Fred, we certainly hope you will be back again. We will be doing a live situation briefing every Thursday at 3:00 p.m. For the foreseeable future. I am now very pleased to introduce and welcome Laurie Givan, the Executive Director with the Mercer Island Chamber of Commerce. And Laurie's going to talk about some of the things the Chamber has been working on. Laurie, welcome.
Thank you, City Manager.
I think we need to get your mic on there, Laurie. You're live now. Okay.
Perfect.
Thanks.
Thank you, City Manager, Mayor Wong, and Superintendent Colosky. Good afternoon. I'm Laurie Givan, the Mercer Island Chamber of Commerce Director. The Mercer Island Chamber of Commerce is an association of businesses, including restaurants, retailers, nonprofits, and many professional services providers. Our offices in Town Center will be closed until April 24th. However, I will continue to work remotely throughout this crisis. You can contact me anytime through our email, which is listed on our website. If you could switch to the next slide, please. The Chamber will continue to be a conduit of information for government to our businesses, from government to our businesses, business to business, and business to our community. Businesses and community members can always access our website, mercerislandchamberofcommerce.org. We will provide daily updates for business resources as we receive the information from the state, county, and city. We will continue to work closely with the city as we learn more about this crisis and think of solutions to help our businesses. We will also do our best to provide relevant information on how the community can connect and support our businesses. Next slide, please. In the near term, COVID-19 is severely impacting businesses and jobs, and Islanders are in a unique position to help businesses in our community. Help that is needed immediately while our businesses wait for state and federal assistance. We've put together some suggested ways to continue to patron our businesses, such as purchasing gift cards for use in the future, booking appointments for services like massages and haircuts in the future, and going online to many of our local businesses to see if they are offering delivery or outside pickup of their products. We know many are currently doing this, including most of our restaurants and several retailers. Please visit our homepage on our website to see our section titled How to Patron Our Businesses. Next slide, please. In closing, the Chamber is available to all of our businesses and all of our public, and I can be contacted by reaching out to our email, which is info@mercerislandchamberofcommerce.org, or our telephone 206-232-3404. We did get a question before this that I wanted to answer. It was asking how the Chamber has been communicating with businesses and what our strategy is. And the Chamber has been communicating with our members since March 5th. We have sent out 5 email blasts to our member database, along with several Instagram posts, all of them providing relevant information around the COVID-19 situation, and all of them telling them they can contact us with any questions or concerns. The Chamber and our staff and the chamber staff, which is myself and our board, representatives for our board, are talking daily. And earlier this week, we did have a meeting with some business owners, representatives from the City Council, and the Chamber of Commerce Board. And we formulated ideas and action plans to assist businesses. The Chamber, along with the City Council, will be sharing a letter with our members and other businesses later this week or early next week. Thank you very much.
Thank you very much, Laurie. And Mayor Wong, I know that you were part of the meeting that took place earlier this week with the chamber and business members and a couple other council members. Did you want to share anything else about that meeting?
Just a few words. First of all, I want to thank Laurie for her leadership on behalf of the business community and certainly the members of the chamber. I think the meeting was a good one. It was a productive one. Members, again, there was only 3 of us there from the City Council. But again, as I told the people who were at the meeting, I think every single City Council person would have loved to have been there. And I think going forward, I know that we have discussions about having ongoing dialogue and meetings with members of the chamber and also with different businesses, with all the City Council members, so that we can get a better idea of the needs of the business community and how the city might be able to partner with the city businesses. So again, I really thank you, Laurie, for stepping up and being there so that we can help and learn from you.
Thank you very much, Mayor Wong. I will leap ahead a little bit in my presentation and mention that the City of Mercer Island, just yesterday, we reassigned a team member to specifically support small business initiatives. And as we get going, we felt that it was needed, that resource was desperately needed. So I'll say a bit more about that in a moment. This was a slide that we shared last Thursday, and I think it's really important to remind the Mercer Island community about our operational priorities during this emergency. The City of Mercer Island is top operational priority is maintaining essential services. This is continuity of your police and fire departments, and in just a moment, we have both chiefs here. They'll be providing an update. Keeping our roads open and safe, maintaining our utilities and the associated infrastructure, ensuring, and this is becoming more and more relevant every day, that the city has the resources to support these essential functions in anticipation of a prolonged event. I would say a month ago we were talking weeks, now we're talking months. And finally, and really importantly, supporting our staff and ensuring a healthy and safe workforce for them. I want to pause for just a moment and tell you a little bit about our staff. They have been working gas pedal down really since February 29th when the first case was announced here in King County. We have to force them to stay home. Many of us are telecommuting now. People want to be here. They want to be serving their community and doing their job. I am just so very proud of them. Every day there's change, there's new directives. Our operations are literally morphing every 24 hours or so. So you have an incredibly resilient staff team, and they are working very hard on your behalf. So thank you, City of Mercer Island staff. All right, this is probably the top question that we are getting here at the City of Mercer Island. How many COVID-19 cases are on Mercer Island? We have 2 confirmed cases that we know of. These are the cases that we informed you about last week. And there are likely more cases. So what I want to explain is, if there's a confirmed case at a senior living facility, the City of Mercer Island is notified. But that information is no longer being published. And the reason for that is really mostly to do with privacy, but also the challenge of managing media when they show up to senior living facilities. We need our senior living facilities focusing on caring for the residents that live there and keeping their staff safe. So that is a recent change. I also want the community to know that the city does not receive information on any other confirmed cases. This is not information that is provided to us. So many of you have called and said, I heard, my neighbor has a confirmed case, or a student in my child's class has a confirmed case, and that may be. We do not have that information. The guidance we've been given is yes, assume these people that are potentially you're going to interact with have it, so don't interact with them, and assume you have it. So keep a distance. People with COVID-19 symptoms are still being advised by medical professionals to quarantine. That doesn't necessarily mean they have a confirmed case, and testing is still limited. This is going to be the situation for probably quite some time. I know this is frustrating. We're a data-driven society. I'm a data-driven person. But this is why it's so important to adhere to the social distancing guidelines. Testing and data are limited, and that will be the case for probably the foreseeable future. In King County right now, there are over 500 confirmed cases, and that number will likely increase. If we work together, and you've seen this graphic previously, we can flatten the curve. If you have a potential exposure to COVID-19, this is another question we get regularly. Public Health recommends that you monitor for symptoms for 14 days at home. Fever, cough, shortness of breath. During that 14-day period, you should avoid going out in public at all. Work or school, which schools are closed now, so that is no longer a factor. If you have symptoms of COVID-19, you should first call your doctor. Do not go in. That's really important. I want to say it again. If you have symptoms of COVID-19, Public Health is advising you to call your doctor first and not go in. Your doctor will work with you on a care or treatment plan. And we also want to say, and you'll hear the fire chief echo this in just a moment, if you are having an emergency, please do call 911. It seemed there might be some mixed messaging that you shouldn't call 911. That's not the case. We do want people that are having medical emergencies or other needs to use 911 services. This is also a reminder that Public Health Seattle in King County has jurisdiction over this public emergency. Excuse me, I should say public health emergency. So we are taking direction and advice from them. If you haven't done so already, I encourage you to go to their website, and you can sign up and receive their usually at least daily briefing. It comes to you in the email. Sometimes we get 2 or 3 updates a day. It's really, really important information, and it covers a range of things from parks to schools to child care facilities and caring for your own family. All right, switching gears for just a moment, I would now like to welcome Chief Steve Heitman to the podium. Chief?
Good afternoon, citizens of Mercer Island. Steve Heitman, your fire chief. Just want you to know the city manager already said we have those 2 confirmed cases that we know of. There are potentially others that we have transported, but we have not gotten feedback on those calls other than to say that as the health officer, I receive a report every day that says whether or not we have a suspected exposure of our crews. And I am very happy to report we have had 0 to date. We're very fortunate because we got on this early and we started using the PPE early within the situation. Right now, Mercer Island Fire Department is still at normal staffing levels. No personnel are off related to COVID-19. We stepped up early, as I said, and we've been able to secure PPE, which is personal protective equipment. A lot of departments are struggling with this, but we are fortunate that we've been able to get some, and other departments have shared what we do not currently have. Staff morale is good at this point, but this is going to be long. This is going to be ongoing, and so we're going to do everything we can to maintain that. Again, some of the steps that we have taken as a department is that we're doing daily wellness checks. Whenever somebody enters the building, and we're only allowing essential personnel that are staff members of Mercer Island Fire into the buildings, they do a temperature check right inside the door. If they have a fever, they're immediately sent home. We're also having them answer questions on whether or not they've been sick, flu-like symptoms. Have they come into contact with anybody sick, just as the regular public is? And when those all are affirmative, then they're allowed to come in and finish or do their shifts. We're going to be moving to, during their shifts, they're going to take not only the temperature at the beginning, but at the midpoint and at the end of a 24-hour period so that we can keep an eye on this. We've updated our dispatch criteria again so that we are getting alerted when we're going to high-risk facilities. As we said, currently there are 2 that have known COVID-19 patients on the island. There are 27 within the county that have been identified for positive COVID-19. One of the things that we do is we send in a scout, and that scout has on full PPE to every EMS call. It doesn't have to be a high-risk facility. They go in, they start asking some of the basic questions so we can determine if this call is related to COVID-19 in any way. Once they have gotten satisfactory answers to those questions, it determines our level of PPE. If the whole crew needs to go with the mask, the eyewear, the gloves, and the gown, then everyone gets into that. And again, we ask them those simple questions on if they've been sick, flu-like symptoms, temperature, vomiting, those sort of things. I'd like to give kudos out to our EOC and especially Commander Jeff Magnan, who has been outstanding in getting us equipment. We've had everything basically that we have asked for delivered to this point. It's not going to be ongoing forever. I was on a national level conference call this morning with agencies from all across the United States, and everyone is starting to struggle to find this equipment. It is on order. We know that we have a bunch in the national stockpile, but right now they're trying to decide how they're going to give this out. Even though there is a lot on hand, when you start taking account all of the agencies across the United States, it doesn't mean that there's a lot for everyone. Other things that we have done. We've canceled all classes and non-required training for the department for the foreseeable future out until June. We're using media platforms such as Teams or Zoom or even just conference calls to hold those meetings. We're trying to keep the South End crew at the South End as much as possible. Again, every time that you are out and about, every time that they come into contact, whether it's with another crew, it's a potential exposure. The good news is we're still at a point where if they're wearing full PPE, it's not considered an exposure, even if they do have an encounter with someone who has COVID-19. We're no longer doing blood pressures at the fire department. You can get your blood pressure taken either at your doctor's office or you can have it done at one of the pharmacies with one of the machines. We are tracking this and putting a lot of information into our records management system so that the county has access to these records, which is how they determine the potential for exposures each day, which has been great for our crews in feeling confident that this information is being utilized. Despite the fact that the lobby doors are locked, it does not mean that we are not open for business. It does not mean that we do not want to assist you if you are in need of medical attention. I want to make that clear. We're just not doing the basic items any longer. But if you feel that you have medical assistance, either call 911 or if we're at the station, we will answer that door. I also just want to let you know that we are working with our union on this. There's a lot of change involved in this, and as is we are bound to do whenever we make changes to how we operate, we need to have a discussion. And they're working very well with us. They're being very supportive and understanding, and this goes up at many levels, including some of the policies that we are putting in place as a region right now are being looked at by the International Association of Firefighters and may be utilized across the country. We're also looking at various operational models. What happens if we do start getting sick? It is projected that this is going to come in waves, and the potential for the second wave being much worse than this first wave is out there. So at some point, we may start losing some staffing. We may need to look at people not being at work. How are we going to handle that? How are we going to change our level of service potentially? How are we going to get firefighters perhaps from other departments to come and work for us for a shift or two while we're trying to do those staffing models? So all of that is being discussed right now. What do we know about this? With the increased capability of testing, you are going to see a large spike in the number of positive cases. Don't be alarmed by this. Yes, this disease, we know it is spreading, but also we know that a number of people have it. We just don't know about it at this point. It's just more accurate data. As I said earlier, this is going to be a long-term event. We are planning out until August before things really start to settle down. And we're just now getting a handle on some of the ramifications outside of first responders on how this is going to impact. We know that it's contagious. We know that at this point there is a high mortality rate, but part of that stems from where it started, which was in a skilled nursing facility. As I said earlier, there's 27 locations that have been identified in the county as high risk. There will be more. Symptoms occur on average within 14 days. Sometimes, though, it shows up in 3 days. Sometimes it shows up a lot later. On that conference call this morning, an individual from Nebraska said that they went above and beyond and started requiring 3 tests after an initial positive before they would allow somebody to come back, or before the initial negative. And on the 3rd test was when they found somebody. Most other places are only doing 2. This virus is not functioning like a normal virus for us, and so that's why things are changing rapidly. And each day we're on a conference call at 3 o'clock, Department of Health, King County EMS, the fire chiefs, all the health officers, and we're finding out the new information, and then we're adjusting policies accordingly. First responders, the good news, first responders have moved to a tier 1 level for receiving personal protective equipment. Unbeknownst to us, when this first happened, equipment was released to the state, and the state sent it to healthcare facilities, which is what they should be doing. But what we didn't realize is that we were on tier 2, and there wasn't enough for tier 2, which we then quickly pointed out, if they don't get to the hospital or can't get to the hospital, you're not going to need your PPE. So we have now been moved up to tier 1, which is good news. What can you do? Go to the public health website, get your information there. It's the most up-to-date, it's the most accurate information that you're going to get. You can get on newsletters so that you can be inundated with as much information as you desire, and you will be well informed. If you have any symptoms like a fever or respiratory problems, call your health care provider. If you need to be tested, that's how you're going to be tested. One of the questions that came in from the citizens was about the drive-through testing. At this point, the University of Washington is the only drive-through facility that has set it up. You can only go there by appointment, and the appointment can only be made by a healthcare provider. So go to your healthcare provider. There are several testing sites that you can go to. They have access to them. I do not know what those sites are. Hospitals are strained right now for beds. So even though we come and we see you, we may not take you to the hospital because this is not a normal situation. If you have an emergency or a life-threatening emergency, you will be given the best care possible. We will get you to the hospital, but we are trying to keep the hospitals available as best we can for those that are in critical condition. We always will respond to life-threatening emergencies. So again, despite the fact that the fire stations are locked currently, it does not mean that we do not want to help you. Call 911 or ring the doorbell. We will answer. Avoid close contact with people who are sick. Avoid the crowds. Just because you're off from school, it doesn't mean that you should be getting together and going on play dates. You have to keep that distance. One of the newest things that has come out is even though this is not considered an aerosol virus, which means it spreads through the ventilation systems, it is spread by droplet. They are finding that if someone coughs, and it is a productive cough, that it can be sustained in the air for a short period of time and inhaled, which then it's in your lungs and you now have it. So social distancing is important. Clean and disinfect your high touch point areas, all your doorknobs, all your handles, everything that you touch, your counters. Make sure that you're keeping them clean with disinfectants or alcohol. Make sure that you have several weeks of medication. The pharmacies are all open, everyone is getting supplies, but as we're moving forward, we don't know if and when that's going to change. From the fire department and the city, we greatly appreciate your offers of help, especially for food, which are coming in. But at this time, those resources we feel need to go to those that are more needy. So look at charities, other means that you can find for volunteering for that. We are doing fine at this point. We've also been asked about donations for unused surgical masks. And again, at this time, we have plenty of equipment. I would ask you to hold on to those to see if we get more equipment. In the future, we may need them, especially if this goes as long as we've said, Or we may look at getting together donations to go to the hospitals because they are still hurting for the surgical mess. Remember, again, this is a dynamic situation. I will give you updates as we go with each week. Thank you.
Thank you, Chief Heitman. I want to take a minute and just update you on personal protective equipment and the modifications that we've had to make to city operations. You may not be aware, but we use PPEs in many city services. Our maintenance staff use them, our inspectors use that type of equipment. We were even using personal protective equipment at the thrift shop. One of the reasons we had to modify operations and close the thrift shop is because we didn't have enough resources, PPEs, to sustain it. Those supplies were needed elsewhere. We're still doing inspections, but we've modified our operation considerably. Again, with supply management in mind, we need those resources going to the most critical areas of operations for our city, which is police and fire. Thank you, Steve. Oh, Mayor Wong, you have a question? Yes,
May I ask a question of the chief?
absolutely.
Chief, I meant to catch you before you left the podium there, or the...
I'm pretty quick, Mayor.
I just want, if you have a chance, if you can elaborate on the worst case scenario that you mentioned, which is we begin to lose our own first responders. And basically, it sounds like you're in discussions with other fire chiefs, other districts about helping out, or at least having others come in and help staff our fire department. Is that right?
Correct.
Can you just elaborate on that whole discussion? I mean, without getting, I'm kind of curious how many departments are we talking about? Is it just within the King County region that we're talking about, or?
It depends on the level that we need to go to. If it needs to be sustained, it's going to go outside of King County. We'd be looking at state mobilization. Part of it's going to be based upon who's affected. As you saw early on, Kirkland was down at one point. 33% of their staff was out sick or in quarantine. They're large enough that they could maintain their minimum staffing, but they were very close to where they didn't have enough people to fill those slots. For us, that's going to happen at about 33%, but it's a very much smaller number of people that we would need. Our first inclination is to fill it with off-duty staff, and we can do that for a time. But when you start seeing that this is going to be ongoing, we may not be able to fill all 7 positions that we currently staff daily. We would look at, and we have to have agreement with the union on this, and this is all very early conversation, but we would look at either hiring from the outside for firefighters who are off duty from another job, or we would have to look at service levels. We may have to take it down to where we staff 1 engine company and 1 aid car if we only have 5 people on duty. All of those are potential issues, and what we're just trying to do is we're just trying to be prepared in case those decisions have to be made.
Great, thank you.
Thank you, Chief. And now it is my pleasure to introduce Police Chief Ed Holmes for an update on police operations. Chief?
Okay, good afternoon. I'm Ed Holmes, your police chief, and I want to just highlight a few things we are doing. This scene here, or this slide here rather, I spoke to last time. We're doing personal hygiene around the station. We have hand sanitizer throughout the station, and in the patrol cars they have wipes that they're using on all the equipment. So we're trying to stay as much as we can, keeping ourselves healthy before we go out in the community. Dispatch is screening for these calls. All the officers are given PPE, as the fire chief mentioned. We have some changes in our protocols. We have modified schedules for those not in patrol. Most of them are telecommuting, and we have some reassignments available if we need to. People who are not currently working in patrol could be reassigned to patrol if we get there. So, first bullet here, we're continuing, as I say, to do what we can. Crime is still happening, and I'll speak to that in a moment, but we do need to keep our officers healthy. We do have one officer who was potentially exposed. He was exposed to somebody with flu-like symptoms while he was off duty. And so he self-quarantined at home. He got tested, and we should know by tomorrow, we hope, what those test results were. I mentioned officers wearing PPE when appropriate, and I also mentioned NORCOM screening for these calls. And an example how this played out was a couple nights ago. We went to a disturbance call. Dispatch had screened the call for potential COVID symptoms. As it turns out, the person calling had in fact self-quarantined and was tested for COVID, but was waiting for test results. So knowing that ahead of time, the officers were able to put on their protective gear, deal with the situation, and then of course take it off when they were done with the situation. And in doing so, we learned a couple things along the way, a few things that could make things a little more efficient, how things are put on the uniform and how we take them off. So that is happening. I'm pleased to know that NORCOM is indeed screening for these calls. Whenever we go to a care facility, we're following what fire's doing and putting on the protective gear when we go to those care facilities. We're still making operational adjustments, and those seem to change almost daily. Sometimes they're real small tweaks, but we are continuing to make some adjustments as needed, again, to try to keep officers as healthy as we can. I mentioned the non-patrol staff. They're telecommuting as much as they can. And our training classes, they've either been canceled or moved to online. So some of our annual mandatory training classes are online classes. So to the extent we can take those now rather than later in the year, let's take them now while a lot of staff are telecommuting. That certainly makes sense. And then our regional meetings, a lot of those have been canceled, postponed, or moved to online format. I mentioned in the next slide, I talked about crime. So despite this virus, crime is still happening. And as with a lot of emergencies or disasters we've seen, the bad guys do take opportunity to use this as a time to take advantage of people. So senior citizens seem to be a favorite target. So a few suggested bullets there. Be very wary. If you get a phone call or an email someone's claiming that they just need a little bit of your money and they can go help people who are a victim of the virus, just be really, really wary of that. Don't give your personal information. If you get a phone or email solicitation, don't give personal information out, especially your bank information or social security card. Just hang up. And it does not fall into the category of poor manners if you hang up on somebody. It's not poor manners to hang up on a criminal. It is not poor manners to hang up on somebody who wants to take advantage of you. So just hang up. I mentioned earlier just a second ago about senior citizens seem to be a favorite target. I have had numerous conversations with my parents about this over the years. And despite that fact, my mother was a victim of one of these phone scams. And so if your police chief's mom can be a victim, so can you. So again, the emphasis here, hang up when something doesn't sound right. It's not being rude. And then you can certainly call the non-emergency dispatch number. You can call 911 if there's an issue or an emergency, please call 911. But if not, there's a non-emergency number, 425-577-5656 is a non-emergency number, and our police officers would be happy to talk to you about a phone call or an email or a solicitation. If it doesn't sound right, we are really happy to talk to you about that. So I want to keep the officers safe and healthy and to be able to respond to issues like this or the disturbance we had the other night. So again, we're doing what we can to keep people healthy with the officers so we can respond to the community. That's it. Questions? Anyone?
Thank you very much, Chief Holmes.
Okay, you're welcome.
Right, we have a couple more updates here. Utility assistance, we have received a number of inquiries in terms of what the city is doing to help those that are financially impacted by COVID-19. We are working right now on a payment modification policy for our utility bills. That information will be coming out to you very soon, probably sometime next week. We do have a program available for people that qualify for low-income services. It's available on our website. We know that our utility partners also have programs available, and I've noted here Puget Sound Energy has programs in place for customers that are experiencing financial hardship. This is incomplete information right now. We will be updating our website and publishing all the links and resources in the coming days and weeks. Backflow testing. We did receive a couple inquiries about the status of backflow testing. And here's what I can tell you. For those of you that are required to perform backflow testing annually, we will not suspend the annual requirement. And that's because your devices need to be properly functioning to ensure the safety of the city's water supply. We understand, however, that you may experience a delay in completing your test. If possible, particularly if your backflow meters are located outside as opposed to in your home, we would like to have you complete those tests. We will be making a modification to our policy for those of you that experience a delay so that you do not incur a fine. If you have backflow assemblies inside your home, we do understand that for your safety, this is not an appropriate time to complete that test, and we will be modifying our policies to allow that test to be deferred. Again, we'll have more information coming out on backflow testing in the next week or so, and that will be published on our website. We talked earlier about our priority and supporting local businesses. I wanted to let you know that we have a Let's Talk page now live, and there is a dedicated section supporting Mercer Island businesses. We are receiving information from the state, from the county, from the chamber, even from, and I need to give a shout out to citizen Jim Eanes, who compiled a list of all of our restaurants that are open and information on how to access delivery. That too is posted on the Let's Talk page. Thank you, Jim, for your work on that. We'll be updating that really daily, if not more often. So if you have additional information you'd like us to include, please send it our way. I announced this earlier. Given the changing circumstances at the City of Mercer Island, I have reassigned Sarah Bluevass to be our small business liaison. She will be working with the chamber, small businesses, members of the council, and others during this emergency. Many of you know Sarah Bluevass from our Parks and Recreation Department, and her phone number and her email address are posted there. By the way, I should have mentioned previously, this presentation will be available on our website. There's quite a few phone numbers and additional contact information that you may want to access. Shopping hours, if you've been out and about today, hopefully you haven't, unless you had an essential need. You may have noticed our variable message boards at the north end and the south end of the island, announcing priority shopping hours for people that are at risk, including our seniors. New Seasons Market, thank you very much. 8 a.m. to 9 a.m. Monday through Friday is shopping hours for seniors only and at-risk populations. QFC, both locations, is 7 to 8 a.m. Tuesday and Thursday. I need to give a special thank you to Councilmember Salim Neese. He has been working on this for the past week diligently. These were not easy things to achieve. It required a lot of phone calls and many, many emails. So thank you, Councilmember Neese. We are now working with our local drugstores to see if they will provide the same opportunity. I believe outreach went out to Walgreens and Rite Aid today. We will announce any opportunities for senior shopping hours on our website, on our social media sites, and on our Let's Talk page. I'd now like to introduce Youth and Family Services Director Cindy Goodwin for an update from YFS. Cindy?
Good afternoon, members of the community. Cindy Goodwin, Director for the Department of Youth and Family Services. All Youth and Family Services programs continue to take place. They're in the community. We've closed the Luther Burbank building for health and safety reasons, but all of our services and programs are being done at different locations. So the food pantry. Clients are being served at the Mercer Island Community and Events Center. The Slater Room there will see people three ways: Tuesdays 10 to 1, Thursdays 1 to 4, or by alternative arrangement. So anybody needing services for food cards, let us know. We've stopped doing food bags or any kind of food pantry. We've really gone to handing out just food cards. So if you know of anybody who has food insecurity or needs something like that, please have them reach out to us. They can do that by contacting Cheryl Manriquez. Her number is here. She does all sorts of financial assistance and working with people to get them the resources they need. We've had a lot more applications for finance and rental assistance just with people who are service workers or gig workers having lost their job in the past week. So we are still open to that. Cheryl's contact information is there. Our next services are clinical counseling services. All of our counselors are still working. They're doing teleconferencing. They are working with children in the park out in large spaces. And this week we should have up video therapy. We're working through the HIPAA compliance with that and working to get that up and going. And that should be up tomorrow and by next Wednesday at the latest. We're working on that now. There's one way that you can always get in touch with us. You're going to see a lot of numbers out there, but this number, the intake number, is always available and it is checked regularly throughout every business day. We will get your message and we will get back to you. And it's a confidential voice line. The next one is senior services. And senior services, thank you. So senior services, we have counseling and case management. Betsy Zuber is still doing that. She's also helping with financial and food assistance. We're also staying in touch with the kind of grassroots efforts that are happening in the community. We've put out our feelers to many seniors that we know and that we work with, not specifically those at risk, but just general seniors who work with us, and said, if you're hearing something that we're not, would you please let us know? You might hear it before we do. So we're really trying to keep our ear to the ground out there. And let me see, I think that's good for seniors right now. We are, for the thrift shop, it's not up here. I just want to say something about the thrift shop. The thrift shop is closed. But I do want to say that if you see the bins out in the community, you're welcome to put things there if the bins are not full. We're collecting from the bins. They're being disinfected before we take anything. We take the goods, they sit someplace for 72 hours, and then our staff are working individually in rooms by themselves at the thrift shop so that we work online. And there are many avenues to continue to bring in revenue. So that's happening at the thrift shop. So where we are picking them up at the bins throughout the city. Please feel free to drop off there if there's nothing there. If the bin is not full, we will pick them up. And this information will be posted today. All of our staff, like everyone, is telecommuting, and here are the school counselors. If you have children in the schools, or you have children at Mercer Island schools, each of those counselors is still working with their youth or their children. And if you're a parent and you need any resources, you are welcome to call those counselors, and they will get back in touch with you. They're at their offices at the schools. And I think for Youth and Family Services, we want just the word to be out there that we're here for anybody who's vulnerable, seniors, children's, people who have any kind of financial concern or food concern. We're here now, and we plan to be here throughout the pandemic for as long as this goes on. So reach out. And again, there's a lot of numbers. There's a lot of resources. They're on the city's website and our Facebook page. But just remember the intake line. You can refer somebody to that, or if you have a question, you can call that line. And I just want to say that also we are taking food cards. Because we are no longer handing out food, we're in need of food cards, and there have been many generous Islanders have made donations. And if you're interested in making a donation of food cards, please mail it to Youth and Family Services, or there's a drop-off here at City Hall in the police entrance. There's a white drop box, and we welcome donations of food cards.
And Cindy, I seem to recall that we were seeking either a $25 or $50 value food cards.
Thank you, City Manager. Yes, $25 or $50 denominations.
Excellent.
Thank you.
Thank you for your update. We've had a number of questions about our permitting process. So what I wanted to let you know today is our entire planning department is working remote now. That should not impact our ability to process your permits. When you call our phone numbers, they are forwarding to staff working in their homes. Most of our permitting information has now been updated on our website. If you have a question, you can call the permit phone number 206-275-7605. This next slide really just tells you that we're going to be working with you in a new way to review your permits. It may be as easy as a phone call or email to clarify something that's in your permit, your application, or your submittal. In some cases, we will need a plan set submitted. We have a FTP website set up to allow you to submit large files. And again, a staff member will be available to help you work through this new remote process. One of the questions we were asked is, are permit volumes down? And actually right now they're not, which is a little bit surprising to me. That may change in the coming weeks. But right now we're seeing a steady influx of permits. So thank you to the planning department for mobilizing your remote operations so quickly. And thank you to the community and the public accessing these services for your flexibility as we worked through an entirely new process. Finally, just a few slides to wrap up here. On communications, the city will continue to communicate with you via our website, via our social media channels, our new Let's Talk page, and through these Thursday live briefings at 3:00 p.m. We did receive an email yesterday on the 2020 census. We understand that field operations for census workers have been suspended, for safety reasons. We recommend, while all of you are at home, that you check your mailbox for your census information and go online and complete the census information. That will actually reduce the need to remobilize those field workers. Parks. If there's another top question we've been getting is, what about parks? Are you planning to close parks? Are you planning to close playgrounds? At this time, our parks, our playgrounds, and our public restrooms will remain open. That may change, however, and we have specifically asked Public Health for directives and guidance on this. Important things to remember: when you're using our parks, the same rules apply. Please keep a distance. Please only go to our parks if you are feeling well. And here's another graphic. We have a wonderful park system. We have plenty of trails and places to walk and experience and beaches to visit. Again, we still advise keeping a 6-foot distance. I know myself, I have children. My twin girls are 5, and although we talk every night about what's going on in the world, they don't exactly understand it, and I don't think they would be able to maintain a social distance safely at a playground. So we're choosing to do other things like biking through our parks, taking a walk, having a picnic as a family, and I encourage you to do those things as well. You will see signage going up in our parks advising people of proper safety measures that we recommend they take during this public health emergency. Okay, wrapping up, neighbor to neighbor help. We've had certainly many wonderful people come forward and offer to help. We want to make sure our seniors and other high-risk people are safe throughout this public health emergency. If you have a personal relationship with a neighbor who falls into a high-risk category, someone that may not be able to leave their house, we do recommend that you reach out to them, preferably by phone if you can. And we are discouraging right now the mobilization of community volunteers because it can't be done safely. However, Public Health, Red Cross, and many other organizations are working on protocols should we need to mobilize trained and vetted volunteers. If you want more information about how you can help, we have some links on our website. Important reminders, I've gone over these many times before. Stay home, wash your hands, stay healthy, social distancing. We have many great websites that are updated daily, many times twice daily. Public Health, the city's website, the school district, the chamber, and certainly the CDC. We will be back next Thursday at 3:00 p.m. If you have specific questions that you would like us to address, please send them to citymanager@mercergov.org. That email address is checked by many staff, and we would be happy to get your questions answered. Thank you very much for joining us today. This broadcast will be recorded and available on our website shortly. Thank you.